One of them is, what the heck is a general surgeon talking about patient health professional experience project? And number two, in the middle of epic implementation and all these stressful situations that we have, what is the best time of talking about this? Right? Anybody had that question?
I did.
But I thought actually this is the best time to talk about this. Okay? So I want to be very truthful and honest with you and answer those questions. But I want to also ask you a favor to be honest with me and tell me the truth. So I'm going to start with a series of questions. And I want you to answer my questions with yes or no, good or bad, or just raise your hand. And if you're scared to raise your hand, just raise your finger. But the appropriate finger. So, do you love your job?
Yes.
Yes.
Do you love the place that you work?
Uh,
Yeah, I like the honestly.
honestly.
And do you feel extremely enthusiastic and energetic in the morning when you come to work?
Yes. Yes.
I wake up a little bit.
In the morning.
There's
Do you-
night shift here.
And do you feel content at the end of the day? Do you feel good about yourself, what you did?
A lot of times.
Yes.
Yeah. With
Do you like the people who work with at work?
Yes. So,
I know.
And how about morale in your workplace? What do you think about the morale? Is it good, bad? Do you think there's a teamwork involved? Do you think people around you helping you and have your back?
yes.
Yes.
We have a great group here. I didn't expect all these good responses. I thought we're going to be honest, right? So don't worry, we don't have any cameras here other than my camera. So it's going to go to my website. No, I'm kidding. And do you think that your work is stressful?
Yes.
Yes.
It is.
Good.
Absolutely.
Absolutely, right? Do you think your work is making you irritated and frustrated at times?
Sometimes.
How about your sleep? Do you think your work has anything to do with your sleep? Do you
Yes.
have any trouble sleeping at all?
Yes.
No, I do
No
not.
problem.
Night shift.
Night shift. Night shift problems, yeah.
Do you think your work has any physical effect in your body?
Yes.
Any mental effect?
Yes.
Do you like your boss? You don't need to
Yes.
answer.
Yes.
And do you think you have been appreciated at work? The effort that you put in, has it been appreciated?
Our boss, yes. Other people?
Do you think your voice has been heard? Do you think you have any control on what you do? And do you think you have full performance, your productivity at work? Let me tell you the truth. 96% of nurses, they reported that they're already tired and exhausted before even they start the shift in United States. And this is how you feel when you finish your shift. And a lot of nurses, when they hand off the report, that's and when they finish the work and they want to get out, this is how they feel.
Wild.
And Sunday night, when you think about Monday morning and you need to start the whole week again, this is how you feel.
Oh, so cute.
Yes, your work is stressful. It's associated with the frustration, at times anger, anxiety, nervousness, sometimes confusion and sadness. And everybody knows this is very well proven that the stress has significant effect on our body, physical and emotional. It's been really proven that it increase the coronary artery disease, depression, chronic fatigue, ulcer disease, increase smoking and alcoholism, very common with the stress of work. And it's not just medical work. A lot of people at work, they don't like their job. And essentially, more than 2/3 of people, when they come to work, they're just very indifferent about work. They're not passionate and they're not engaged. In medical field, we sort of have the same numbers. So in 70s and 80s, they came up with the idea of burnout. It was a burnout, nursing burnout. And burnout is a syndrome that is associated with some signs and symptoms. And one of them is emotional exhaustion. And emotional exhaustion is a combination of physical fatigue, the sensation of you pulled in a different direction, and your voice is not being heard, you have no control, you have too many things to do, and you get irritated and upset and angry at times. And the other things that happen in people who burn out is the idea of indifference. You get numb after a while. You clock in, but you check out until you clock out. You get numb. It's just another day. There's no passion, no engagement. And the other thing that happens in a burnout situation is that you feel that you failed. Your achievement, your goals are shattered. So 40% in United States, 40% of the nurses, they have signs and symptoms of burnout. And 20%, they have the idea and vision of changing their career because of that. So those are real numbers. And 25% of nurses, they reported dissatisfied in the United States. In my opinion, probably is more if you really think about it around you. And nursing is ranked 5th as far as the number of days of absenteeism at work. And more than 50% of that is related to the stress of work. But physicians are also not immune to the burnout. You know, on a report that was done in 2008, 73% of physicians, they reported medicine is not rewarding anymore. 63% they said there's no time to treat the patients appropriately. And around 60% not recommending the medicine to their families and friends. And I had the share of sensation in 2012. I was on the top of my game. I was exercising every day, was in good shape, make money, had a car, good house, great family, kids, beautiful friends and great relationship. But I felt no enthusiasm, no zest. I lost my energy. And I didn't understand what is going on. I sort of had everything, but I didn't feel content. And I was irritated, extremely frustrated. Every little thing made me furious, angry, and upset. And I tried to blame everybody else's because of that problem. At times in the operating room, I felt my heart rate is like 200, even for simple things. I felt my heart is coming out of my body. My blood pressure is to the roof. Then, I think it was called midlife crisis, right? Then I started studying extremely hard about human behavior, human mind, the relationship between mind and body, try to alleviate the problem, to understand my feeling, and I study about relationship and meaning of life, and also went back to my past. I digged in, and I remember my grandfather when I was a teenager. He was a great guy. He was incredible. He was tall, thin. He was bossy, stubborn, but yet kind and very well respected with his family. He had 2 sons and 4 daughters. One of them was my mom. And I remember we had a lot of grandchildren, but among all of those, he really loved me the most. And he wasn't one of those, touchy-feeling grandfather, love. There was no kisses and hugs. It was mostly a mutual respect. It was the respect of my personality and who I was become. At the end of his life, the last few months of his life, he developed progressive dementia and lost his memory, his balance, his continence. And we had to take care of him at home, and I volunteered with my mom and 2 of my aunts to take care of him. Every other night I was sort of on call. At night he didn't sleep. The pattern of the sleep was completely changed, and we had to cater to him, wash his mouth and clean his clothes and change his diaper many times and cater to him. It was all-night job. And I remember in the morning I was going to work, and it was very frustrating and exhausting experience for a teenager at that time. But I felt incredible. I felt very proud and humble. I felt extremely energetic and live. And that's what you do, right? That's what you do every day. You take care of people. You alleviate their pain and suffering. You help them to go back to their societies and their families. And we don't get that feeling of contentment. We just get angry and upset and checked out. We don't get that benefit. Medicine had an incredible root in our human history. There was a time that physicians were called God and nurses were called angels. And there was an incredible relationship between health professional and patients. It was a bond. And the medicine was not just scientific field. It was not giving medications to people and taking care of their signs and symptoms. It was about an illness that affected other aspects of their lives. Okay? And over the last 3 decades, what happened? We lost that relationship. It took a huge dive, right? And it's not one of anybody's fault. It's just that the system is incredibly complex. We have a very complex healthcare system and a healthcare culture. When we come to the culture, we change. We try to go through the same pathway. And our culture of healthcare, even though that this is an exaggeration, but it feels like a factory line model. You see, the factory line model came in almost more than 100 years ago. Henry Ford and the rest of his group, they came up with the idea of factory line to improve the productivity of the factories. And actually, it was a revolution. It incredibly helped the economy, improve the people's lives and their salaries and improve the productivity. And we try to bring this concept to our medicine also to decrease the cost and be more efficient, right? But the huge difference is patients are not cars. They're human. They have feelings. So that system created angry, frustrated physician and burnout nurses and unsatisfied patients, right? It created a separation between us and them, and even at times between us. And the worst thing that happened, in my opinion, that it created a culture of indifference. It's a culture of indifference. We clock in and we check out. So 2013, November, you know, at the time that I was going through my midlife crisis and studying hard to understand myself a little bit better and try to figure out what's going on, you know, life threw me another overwhelming experience. My son got sick, and he had to have 8 operations with 3 surgeons in 4 different hospitals. So that process took 14 months before he improved completely. And I had the